Good afternoon and a very warm welcome to everyone who has taken the time to join us today. I am Denise Llewellyn, Chair of RCN Wales Board, and I am delighted to chair the first in a series of webinars that RCN Wales is hosting to explore the nature of race, racism and cultural inequalities within nursing and other settings. We only have 60 minutes today, and I know our guest speakers will provide you with a snapshot of some of the great work taking place across Wales and the UK. Our speakers today are Richard Desir, Director of Nursing, Cardiff and Vale University Health Board. We've Gillian Knight, Nursing Officer in the Welsh Government. I'm delighted that our Chief Nursing Officer, Jean White, has also been able to join us. And we've also got Wendy Irvin, RCN Diversity and Equalities Coordinator across the UK. I think Wales is a great place to live and work. Its culture has been enriched by those who have come from overseas, and we are better for it. The NHS and social care systems across the UK would not work without the contribution of our Black, Asian and minority ethnic members and colleagues. But despite the excellent work that exists, inequalities in health and society still persist if you are from a BAME background, and our speakers will expand on this during this hour. However, we cannot hide from COVID-19. COVID-19 doesn't discriminate, but it has exposed the inequalities cruelly over the past 8 months, with a high percentage of Black, Asian and ethnic minority colleagues disproportionately losing their lives on the front line. Each and every colleague who paid the ultimate sacrifice, we remember and honour. Richard, Jill, Wendy and Jean will present today, sharing their professional and/or personal experiences. All will acknowledge that there is a long way to embrace equality, as well as sharing the positive steps being taken. We will invite you, the audience, to listen to challenges and barriers to equality, diversity and inclusion, and we invite you to contribute and participate in the debate with questions that you can actually put on the line as we listen to each speaker, followed by a Q&A where I will take those questions and direct them to the speakers. So I think it's important. I'm really looking forward to this and the speakers. I've had a snapshot of what they've done and I know you'll really enjoy this. So we'll start straight away with Richard Desir, Director of Nursing, Primary Community and Intermediate Care Clinical Board. Richard, over to you.
A very good afternoon and a warm welcome to you all. My name is Richard Desir. I'm a registered nurse, I'm a Black man and I am a father. And over the next 10 minutes or so, I'll explain why these bold statements are of significance in the context of nursing in the year 2020, Year of the Nurse and Midwife, COVID-19 and the Black Lives Matters campaign. My presentation will be broken down into 4 key segments, namely what's happened globally and also within nursing over the last 30+ years, what work is taking place at a UK level set within the strategic and policy context, and also a description of what needs to happen next. Now, the latter 2 segments will be discussed in much more detail by both Gillian Knight and Wendy Irwin. But I think it's important just to reflect on when I first started my professional nursing career 34 years ago. I was somewhat of a rarity. I was a Black male student nurse. So fast forward 34 years and I think to myself, what has happened up to the year 2020? Well, we've seen the rise of the World Wide Web. We've seen the fall of the Berlin Wall. We've seen the rise of social media, Wi-Fi, smartphones. We've had the smoking ban. And over the last 3 decades, England and Wales has become more ethnically diverse. But it does seem quite strange that the UKCC, the predecessor of the NMC, did not routinely capture ethnicity data. And indeed, the decade I actually started nursing, the government didn't include a question on ethnicity in the 1981 census, something that Parliament later said it regretted. The NMC itself did not routinely capture ethnicity data until the start of the last decade. So this is a busy slide, but I think it's important just to say what hasn't really changed over the last 34 years since I started my professional career. Well, it's clear that the percentage of males within nursing has really stood still. The percentage of males in nursing is actually 10% today in 2020, as it was in the 1980s. It's impossible really, though, to compare the percentage of BAME groups in nursing in the UK because we didn't capture that data. But what is clear is that nurses in Wales are caring for a much more diverse population. And although the BAME population in Wales is small in comparison to the rest of the UK, that population is estimated to treble within the next 25 years, with more than 10% of pupils across Wales from an ethnic minority background, accounting for 32% of pupils in Cardiff, 24% in Newport, 14% in Swansea, and just over 10% in Wrexham. In the context of health in Wales, 7% of the nurses and midwives on the NMC register describe themselves as non-white, which means there's actually an overrepresentation of nursing on the register compared to the population of Wales. However, visibly, there is not an overrepresentation of BAME nurses in senior positions. And that's partly because we don't have the information of BAME nurses in Wales at various bands or leadership management roles. NHS England have actually begun this journey in 2015 as part of the NHS Workforce Equality Standard, where they produce a regular report on diversity within the workforce and leadership opportunities for BAME staff. Within Wales, in the NHS, adults and general care nursing and mental health nursing were the most ethnically diverse areas of practice. People employed for the agency were more ethnically diverse than those in direct employment. And over a third of agency roles across the UK were filled by people of Black African ethnicity. The care home sector actually is the most markedly ethnically diverse than any other care setting. Less than half, which is 49% of those in the UK on the register working in care homes, define themselves as white British. And indeed, care homes rely more on professionals who trained on outside of the UK, accounting for 38% on the accounting for just over 38%. In terms of the student nurse profile, 8.5% of the undergraduates were from a BAME background. And this is slightly increased for the year 2020, where you can see on that slide a 4% increase in applications from Asian, Black and white ethnic groups. I said I would briefly touch on the COVID-19 and health inequalities experience. And this will be discussed in more detail by Gillian and Wendy. But there is no doubt that COVID-19 has had an impact on all our lives, but no more has this been felt disproportionately than within the BAME communities of the UK. The BAME population have high rates of chronic disease, obesity, and premature death. Black patients have amongst their worst healthcare outcomes, experiencing higher rates of hypertension, stroke and infant mortality. And indeed, Black women are 5 times more likely to die in childbirth than if you are white. Denise mentioned the disproportionate high rates of BAME individuals who've died compared to the overall population during COVID-19, and this is absolutely saddening. The excess of BAME and healthcare social care staff who have died during this pandemic has been noted widely. BAME staff account for 21% of the NHS, including 20% amongst nursing and support staff and 44% amongst medical staff. But BAME individuals accounted for 63%, 64% and 95% of deaths in that same staff group. And BAME patients also accounted for just over 34% of patients admitted to UK intensive care units, but only represent 17% of the UK population. These facts are saddening. These are very stark facts, and we can't close our eyes to these facts. And it's something that Margaret Heffernan in her book has called willful blindness. It's actually a term used in law when we willfully shut our eyes to the facts. Facts such as Savile, Winterbourne, Mid Staffordshire, Hillsborough are examples when we close our eyes to these very facts. We have to handle and manage this truth. This is structural racism, and it exists. It not only has an impact on lives, but it has a broader impact on some of our communities. When my 15-year-old teenage son posted recently on social media his support for George Floyd and the Black and White Lives Matters campaign, and the need to raise awareness of BAME inequalities, and also the promotion of Black history in the education curriculum, he was met by the most vicious racist social media attack. It brought home to me that as a father, as a Black man, and as a registered nurse, the need to be more active and less passive, as I have done for the last 30 plus years. The work of nursing now is attempting to open our eyes to these facts and understand that these inequalities are a precursor to promote wider diversity in nursing. Nursing Now is a global campaign with an active network of groups to influence global and national policy. One of its key agenda items is to actively encourage and increase diversity in nursing and midwifery. And this is in keeping with our Healthier Wales long-term plan and our Future Generations Act. So in short, Nursing Now has put forward a number of key recommendations. We wish to raise awareness of health inequalities and promote diversity in nursing, acting as a vehicle for change. We want to establish a nationally funded campaign to proactively market health and social care careers from those from BAME backgrounds. We want to establish a monitoring reporting tool for workplace equity, very similar to the NHS workforce equality standard in NHS England. We want to use the data to understand workforce and set agreed targets for BAME representation across all levels of nursing, representing the population we serve. And we want to consider leadership opportunities and continue to promote diversity activities. 34 years ago, I was a rarity. I still am a rarity in nursing, but I am more active than I was passive. I thank you all for listening.
Thank you for that, Richard. Some very powerful statements and points of view there. And we've already got questions coming in, but I'm going to go straight to Gillian Knight, as we're on the timescale here, Nursing Officer, Welsh Government. Thank you, Gillian.
Good afternoon, everybody. Can you see my screen? Denise, can you confirm?
Yeah, you can see that.
Brilliant, thank you. So my name is Jill Knight and I'm a nursing officer working within Welsh Government. I've been working across care sectors in Wales for over 24 years now. Listening to Richard, we've got a lot of years between everybody here this afternoon. I just want to pick up on something Richard said. Richard mentioned willful blindness, and this is something that Richard and I heard about at an event we were at last summer. And it really is important to recognise that if you should have known something, and you could have known something, but didn't do anything about it, that you are willfully blind. And that really does underpin everything that we're talking about here this afternoon. So I'm delighted to be here in what was Black History Month, but now in Wales it's Black History Year. I'm not sure if many of you have heard of that, but following the launch of Black History Cymru 365, it is now Black History Year. And I wanted to share with you some of the work that myself and Richard have been involved with as part of a ministerial BAME advisory group from May in this year, 2020. We are both, and I know I can say this on behalf of Richard as well, we're very honoured and proud to be members, ensuring that nursing is represented on this proactive, positive and definitely influential group. I'm also privileged to have been working with our Chief Nursing Officer, Professor Jean White, who you're going to hear from this afternoon, for over 2.5 years now. And I know the importance that the Chief Nurse puts on ensuring that the voice of nursing is heard at the table. In fact, over the last couple of years, I've learned that if there's no chair for nursing at the table, that you've just got to bring your own and get it there. So over the next few minutes, I'm going to outline what we're doing here in Wales in response to the disproportionate impact of COVID on BAME groups and the health inequalities as highlighted by Richard just now. As time is tight, within the slides, I have some links for you and access to full reports and further information which we will make available to you after the session this afternoon. We were going to put links in the sidebar, but we don't want to distract anybody with that right now. But I really would encourage you to please take a look after the session and follow up on some of the information you hear about this afternoon. I want to emphasise, can I check, Denise, my slides are moving on. Are we on to the second slide, policy context? Please. Great. Yeah. I want to emphasise the importance of policy in supporting real, sustainable difference and change. Richard mentioned the Equality Act, Wellbeing and Future Generations Act, and of course we also have Prosperity for All and our Healthier Wales, which is our long-term health and social care strategy. These are all underpinned by core values focusing on prevention, health improvement and inequality, which are keys to sustainable development and well-being for everybody living across Wales. Health equity refers to every person having an opportunity to get to and attain his or her highest level of health. In formulating policy and in developing policy, it's so important to consider health equity, and it means that we have to look beyond optimising the conditions and where people are born, where they grow, where they live, where they work, learn and age. This requires us to work across other sectors to address the factors which influence health, which is how it works within government. Many of us know the value in nurses being involved in developing health policy, and this is why I urge you all to please keep yourselves informed of any policy developments. Get involved where you can. Register for notifications on health and social care consultations. Now more than ever, think about projects, work, research, audits that you're all doing in your own areas, whatever care sector you're working in, because they could have policy implications. They could help inform what we are doing. Share your findings, look to publish them, seek help with how you can do this through your colleagues, managers, professional leaders, with the Royal College of Nursing. In April this year, the First Minister launched an urgent investigation to understand the reasons for the higher risk and disproportionate impact to BAME communities, and this is how the advisory group was established in May 2020. So the advisory group is co-chaired by Judge Ray Singh and Dr. Heather Payne. And in addition to having the main advisory group, there's 2 subgroups also established. One led by Professor Singhal, which focused on health and still focuses, should I say, on health and social care workforce issues. And the second is led by Professor Ogbana, looking at the socio-economic factors which may influence poorer COVID outcomes. The All Wales COVID Workforce Risk Assessment Tool, it was the first major piece of work and output from the advisory group, and it's a 2-stage risk assessment to help see who's at higher risk of developing more serious symptoms if they come into contact with the virus. And it also reduces people's risks of contracting COVID in the workplace by helping people understand whether they're at greater risk and ensuring the right actions based on their individual level of risks are taken. Every employer across Wales has a duty of care to protect the health and safety at work for all employees, and this does include understanding if you're at extra risk of COVID. This duty of care includes ensuring an equitable approach for all staff, regardless of ethnicity or any other protected characteristics. So people have been asking who needs the tool. So there, as we know, are already well-established arrangements and guidance for people who had been in the shielding groups or who are considered vulnerable. And therefore this tool doesn't apply to those because existing guidance mitigates the risk that they face. We're really pleased in Wales that the tool is now in widespread use in the NHS and across social care in Wales. And it's also been used more extensively in the wider public sector. We also, I'm really pleased, to say that we introduced a student All Wales Safe Return to Placement passport in September of this year, so just last month, for all health and care students. This includes the risk assessment. This work actually started from a student nurse and student midwife perspective, and thanks to our colleague Simon Cassidy and HEIW for this. Now, the Socio-Economic subgroup published its report in June of this year. So this was the second output from the advisory group, and among many other recommendations, the report highlighted the need to tackle health inequalities among BAME people, including preventing further COVID-related deaths, and does actually place race inequality in Wales in the context of COVID. The report showed us that BAME people in Wales have historically suffered entrenched inequalities. It provides a clear outline of many of the issues we need to address and forms an important foundation for the Race Equality Action Plan. The report identified direct and indirect racist experiences reported by health and care staff in the NHS. Direct reports of these to the panel ranged from perceptions of different and worse treatment in terms of work allocation, PPE availability, and protection from direct racist comments. This definitely suggests that the moral and legal protections against racism for NHS Wales workers are not working and have not been working as well as they should be. The report in itself, and I urge you to read it, is sobering and powerful, and it really does tell us about people's lived experience of racism, and it tells us about a culture of racial discrimination and inequalities that exists today. We in Welsh Government, as we all should, we use the experience and evidence it provides to inform our work as we work to embed wide-scale systemic changes necessary to make equal Wales that we all want to be proud of. The report also highlighted a number of environmental and socio-economic risk factors, including communication of health information, how effective it is, cultural issues relating to suitability of health and social services, income, employment insecurity, poor quality of ethnicity data, housing overcrowding and environment, the financial burden created by migration status, and the role of structural and systemic racism and disadvantage. I'm pleased to say that the report in its entirety has been accepted and the actions are either already been taken forward, completed, or will be further developed in the Race Equality Action Plan for Wales. The recommendation to produce a race equality strategy, a commitment was made to this back in March 2020 with the clear signal that it would be in the form of an action plan, but underpinned by a clear strategy. The current timeframe aims for a draft plan to go out for full public consultation by the end of this calendar year, so by the end of December, with a final plan developed by the end of this Senate term. The workforce, the socio-economic subgroup report, it really is a call to action, not only for us in Welsh Government. Organisational, societal and structural changes are needed, and we all have a role to commit to positive action. In the report, there was a call for more mechanisms for BAME people to access advice and support. I'm really pleased to say, that the BAME Helpline Wales, which is a new helpline established and running since early September. This is for anyone over 18 living in Wales, particularly if they identify as BAME and would like to speak to someone in a language other than English and Welsh. It's multilingual telephone helpline, and it's actually delivered by a partnership between East, Women Connect First, Promo Cymru, Henna Foundation and some other BAME stakeholders to provide information, referral and signposting for BAME people to specialist advice. Funding is from Welsh Government via the Voluntary Sector Emergency Fund, and it's initially for a period of a 6-month project. As I see time, how are we doing for time? Denise, am I? About 2 minutes, okay. Another key recommendation was that Welsh Government we consider the training offer for all around the Equality Act 2010 and to include anti-racist and cultural awareness training. And I'm really pleased that Health Education Improvement Wales are reviewing mandatory equality training package and they will undertake the revisions needed. We've made a lot of commitments around the BAME agenda as a result of the work of the First Ministers Group, and we now need to take focused and structured approach to making sure we meet all the commitments using a planned approach to governance and delivery. My workforce colleagues are currently working on a project plan for delivery, which sets out the commitments and realistic, clear delivery milestones. Richard and I have also been working with the co-chair of the group to identify specifics to be considered that could be taken forward within the NHS. These include campaigns to proactively market health and social care careers for those from a BAME background who are underrepresented in certain groups like nursing and midwifery, and understanding and doing more around the mandated data set as mentioned by Richard. Now I'm going to leave it there because I know we have a lot more to hear this afternoon, and I'd be delighted to answer any questions as we progress through the webinar this afternoon. Thank you very much.
Thank you for that, Gillian. I think that in your presentation you had some fantastic links there that we will be sharing after this webinar. Particularly around the BAME helpline and stuff, so that's excellent. I now like to introduce Jean White, Professor Jean White, Chief Nursing Officer for Wales. And so Jean, over to you.
So good afternoon everybody, Pranav Dar. It's fantastic to spend some time talking about this very important subject matter. Excuse me. So if I like to take us back to the end of 2019, I was very excited about the year 2020 coming up. At the end of 2019, we were celebrating 100 years of nursing being a registered professional group. And I was looking forward to spending time with nurses and midwives across Wales as we celebrated the International Year of the Nurse and the Midwife, being Florence Nightingale's 200th anniversary. And then the world turned upside down. Well, at least it felt like that to me. We had the pandemic, which was unlike anything we had ever experienced since the flu pandemic of 1918. So that's 100 years. Almost at the time that we were talking about having nursing as a registered profession, our ancestors went through something very similar, which killed millions of people across the world. And here we are 100 years later. We're now a registered professional group and we're going through it ourselves. If I think about 2020, though, it wasn't just the year of COVID and a global pandemic which has affected everybody's lives. I think it's useful to also reflect on what happened in May. On the 25th of May of this year, we all watched on TV with absolute horror of a man called George Floyd, who had been stopped and was being arrested because he used a counterfeit bill for his shopping. And during his arrest, 3 officers held him down and 1 officer knelt on his neck until he was dead. It was probably the most shocking thing I've ever seen, and the video clip went viral. And the consequences of this is still having reverberations around the world. There's been civil unrest. There have been demonstrations about the inequity of how some parts of our society are treated by the police and by the justice system. And to be honest, I think having both our experiences of what happened during COVID where we found that the virus so disproportionately affected the part of our population who are Black, Asian or minority ethnic. And you heard very compelling evidence from the previous speaker, Richard, about the disproportionate level of death in that population. And then you layer on top of that the social injustices and discrimination that have been present in our society always, to be honest. I think this year is a turning point for us. I have to say that these are my personal reflections here today, but it made me stop and think about what more I should have been doing and thinking about as one of the senior leaders of nursing and midwifery in Wales. And as you will have heard from our previous speaker, this is something that has led to the Welsh Government taking quite strident steps to look at what is going on in our society about how race inequality and racism and the approach parts of the population have to deal with from their fellow man and woman. It has been quite a stark year for us, to be honest. And if nothing else from today, I would like everybody to sort of pause and reflect about what more they can do. So what I'm going to do now in the time that I've been allocated is to give you some of the actions I've personally taken and some of the reflections I've made and will continue to make as I think about this subject. So you will know that from Richard's slides, we have this campaign called Nursing Now. Nursing Now is a global campaign. We're supposed to culminate this year as a 3-year campaign. It was supposed to be celebrated by the World Health Organization, the International Council of Nurses, and so on. And it was supposed to be a culmination of raising the awareness of the people of the world of what nursing and midwifery professions do for the health and well-being of the population. And so when we decided to set up our own branch of Nursing Now, because it's in over 200 countries across the world, this campaign is, I asked Public Health Wales, which is where the movement is housed in Wales, can we please have a subgroup that looks at diversity? And I was pleased that both Jill and Richard were able to step in to occupy that space to look at this matter. I've been a nurse for 41 years, so I'm one of the older people on the call here, when they're all talking about 23 years and 30 years. Goodness gracious me, 41 years I've been a nurse. And in fact, exactly today, 41 years ago, I started my nurse training. So it just shows an interesting anniversary I'm sharing with you all. I desperately wanted to change the dynamic, because in 41 years, it's been about 10% of the nursing workforce has been male and 90% female, thereabouts. And I said to the team, I really do think we need to start doing some more structured work about how do we widen the appeal of nursing and midwifery professions. I was speaking to Public Health Wales staff on Friday, and they were really pleased to say to me that there is now a male midwife who's in their antenatal screening workforce, which I thought, wow, that's a very positive step forward. What I'm not seeing, though, is progress to do with Black, Asian, minority ethnic nurses and midwives coming into senior roles. And it really struck me when I was approached by the Nursing Midwifery Council headhunters earlier this year to say, what names, Jean, can you put forward from Wales for senior nurses and midwives who might be interested in becoming council associate members to help them prepare to be Nursing Midwifery Council members in the future? And the only person I knew was Richard at a senior level. And it struck me, I was thinking, goodness, there are so few people whose voices I actually hear around the senior leadership table who actually come into my sphere of contact. So I thought, well, okay, what can I do about this? So I decided that, first off, that there is a degree of arrogance for me to think I know what it's like to be a nurse or a midwife from a BAME background. What I need to do is actually listen to what people have experienced to tell me their stories, to actually help me with my understanding about what I should do as a senior leader. So I have taken on some reverse mentors who tell me like it is, tell me the truth, the reality of what it's like on the ground. Of course, even their voices are only their perspective and their lived experience. They can't speak for everybody, but I have to say there's some commonality in the things that they've told me already about having their voices dismissed, about them being passed over and almost being invisible in some of the interactions they have, and how they find even interactions with members of the public, they're not taken seriously when in a situation of seniority. And I'm finding that quite shocking. So much so that I decided to write out to all the executive nurse directors, and I've asked them, what are they going to do to hear the voices themselves? I don't sit in the health boards and trusts across Wales. I have to work through the senior leadership within that organisation. So what I have asked for them to do is to write to me, giving me examples of how they are going to get the voice of their BAME nurses and midwives into their sphere. What are they going to do to encourage people in their careers, to enable everybody to reach their potential, and to think about supporting them when being dealt with in what is a racist way. Now, the deadline for them to write back to me is Friday of this week, so I've only had some responses so far, and I've been quite encouraged by what I've heard. The examples include setting up networks for the BAME staff within their organisation, about developing stronger resources and policies that support people when dealing with racist comments and abuse, about having a helpline, about developing buddies. And I find that quite encouraging, to be honest, that the senior nurses in Wales are taking this responsibility very seriously. Now, obviously, I work for the Health Minister for Wales, and he himself is of a BAME background. So when I mentioned to him in my last one-to-one with him that I was going to do this and ask the nurse directors, he's actually sort of fascinated by what we can do collectively, and is extremely supportive of the approach to do this. So I have to say, although 2020 wasn't quite what I set out to have in this celebration of nursing and midwifery, to be honest, I think some real positives are going to come out of this year, because we have woken up to some of the challenges members of our society have to deal with, and members of our profession are having to deal with. And it is, if you like, the zeitgeist, the moment when you can ask perhaps some challenging questions of one another about what we are doing and what more we should be doing. So some of my other reflections, as I'm sure my time is almost up, or is it up?
Yeah, 1 minute, Jean, please.
So my final sort of observations then, I think it's important that we become allies of our colleagues. We don't want to be speaking for them. What we should be doing is looking for their voices and enabling them to speak for themselves. If you like, to be an ally, a friend. I think it's important that we challenge any kind of racist or discriminatory behavioural language we see. If we don't challenge that, then we are complicit. We are complicit in it. So my final thought is we should celebrate our differences and not suppress them. And we should all take an active responsibility in doing something positive to enable that to happen. Thanks so much, and I look forward to hearing the questions.
Jean, thank you so much for those words of wisdom always. And I am going to move on fairly quickly so that we get the questions in to Wendy Irvin, who is our RCN Diversity and Equalities Coordinator across the UK. Wendy, welcome.
Welcome and thank you everyone. Welcome to Black History Month. And I must say that it's the first Black History Month that I've ever experienced in the middle of a pandemic, whilst attempting to recognise that this is the International Year of the Nurse and Midwife. And I think Jean and Richard and Gillian are absolutely right when they say that this is absolutely a pivotal year. This will either be our finest hour as nurses in tackling these issues, or it won't be. And I'm afraid there's going to be no middle ground. What I'd like to talk to you about today is some of the things that the RCN is doing, and I'd like to share with you some thoughts that I have about how we can move forward as a profession and really begin to tackle these issues in a systematic way. So, Will, could I have my next slide, please? So our corporate equality and inclusion strategy actually asks us, or asks nursing, to be bold and courageous. And it asks that not for any reason other than the fact that it's really hard to imagine a future where equality, inclusion, respect for human rights doesn't feature in the work of nurses and nursing. It's really hard for me to imagine a future. Now, that strategy was conceived almost 4 years ago, and I had no idea then the things that we would be facing. But as our colleagues have shown, that the pandemic has been a bit like a dark mirror. It has shown us the ugliest parts of our society. It has shown us and exaggerated all of those features that perhaps would have remained hidden for a long time. The precariousness of particular roles, the way in which certain people in certain areas are required to put themselves at risk so that we can have the things that we have. And so when we're thinking about what the RCN is doing, I'm really clear that the RCN and that nursing, both in the UK and internationally, needs to be bold. It needs to be courageous, to be its very best, because the future, what we will see, but also what those coming into our profession will demand of us, will be at this moment that we stood and we said something, will be at this moment that we didn't just simply say stuff, but we did stuff that was powerful, that was systemic, that was based on actually delivering the best outcomes for patients. But it was also being clear that we deserve this moment of reality, this moment of truth checking, and this moment of change. So our corporate equality and inclusion strategy is entitled Bold and Courageous About Equality and Bold About Inclusion. And for me, it was really hard to imagine a nursing profession that was somehow afraid of equality, a bit indifferent about inclusion. It seemed to me that a profession that kind of couldn't stand behind those values would be a profession that really would not be able to stand anywhere with any degree of, I think, certainty at all. So what I'm going to be arguing for and what I'm going to be sharing is some of the elements of that strategy, and then giving you some things that I think you can do to stand in that space as allies, but as people who are building your level of interest and understanding. So Will, let's have the next slide, please. So whilst our corporate equality strategy is really about being courageous about equality and bold about inclusion, there are 5 key things that sit underneath that, and they're around challenge and change. And so whether that is for nursing internally to challenge and change perhaps some of the values and belief systems that we've held, or whether it is about a bigger system change around tackling racism or homophobia or transphobia or sexism within nursing, those will be a huge challenge that we have to seek to change. We also need to learn to connect and communicate across difference. So the RCN is a huge organisation, a really large family with a huge membership. But beyond the title of RCN member, there are many things that kind of unite us, but there are also many things where we are very different. And any organisation has to learn to connect and communicate across difference in order to represent the needs of people that perhaps haven't been heard before, or perhaps there have been needs that have been silenced. The third thing that we're keen to do is to think about how we can equip and inform our members or systems that our members work in, both across the NHS, the public sector, and across the sheer plethora of independent sectors that exists, is the ability to actually educate and know more about what this work called inclusion looks like, what it looks like as a practitioner, what it looks like for teams, the outcomes it would deliver for departments, but also for big institutions, and perhaps we're looking at systemic rewiring. So the ability to equip and inform people is really important, and it's important to recognise that no one simply wakes up in the morning and understands how to work with, deal with, and imagine a whole world of difference. When I think about it, and I was talking to a senior leader in another organisation quite recently, and they were being quite hard on themselves about the things that they didn't know. And my advice was this: actually, as we grow as professionals, as human beings, we learn to acquire a whole load of skills. After all, we were born basically knowing how to breathe and blink. But everything else we've acquired over time, and this is no different. So how we learn to equip and inform ourselves about the things that we need to be effective in this space called inclusion is a really, really powerful thing that the RCN is keen to do. How we're able to inspire people to become active as forum members, as reps, is also really important. And I think now, in a stage where we're thinking about fairness and compassion and pay, those things are really important. So I'd advise you to keep checking our online site, looking at the RCN Fair Pay campaign, and actually thinking about how can you get active and support something that will help you in the long term. And then the final thing that we're interested in is this idea of identity and intersectionality. And I think for a very, very long time, people have believed that we can salami slice ourselves, like this part of myself comes from a Black and minority ethnic background, this part of myself is female, this part of myself has this activity or this identity. And the reality is that as nurses providing holistic patient-centred care, we don't experience our protected characteristic, one characteristic at a time. We experience them as a blend of things, and they in themselves shape and create completely different outcomes. So this idea of recognising our different identities, and Richard put it so beautifully, he talked about his identity as a nurse, as a Black man and as a father. And in some spaces, the idea that, Black men and fatherhood, highly contested, but they learn to shape, or they have a massive impact on how we move through life and the outcomes that we face. And actually building our ability to understand and shape this is really, really powerful for nursing. So we've got 5 corporate priorities, but let's look at kind of the next slide about how this translates into some of the practical things we're doing to support you on the ground. So you can actually join in on the Inclusion Cafe, which is a fairly new thing for the RCN. It aims to build and source and share tools and techniques that help us to support our own leadership and accountability in creating inclusive workplace cultures. And I think that there's something very interesting about this whole idea of leadership. So when I was growing up, I believed that leadership was when you got to a particular job, or when you had X number of people working underneath you. What I've now realised is that in this space, leadership is about all of us. We simply need to acknowledge that we are CEOs of self, Chief Executive Operating Officers of who we are, what we choose to do with our time, where we choose to place our attention, and the things that we choose to say and do. And so learning how to actively be powerful in that is the difference that makes the difference between organisations and policies that say one thing, but the lived experience within a team or within an interaction with another person that is the difference. So have a look at the Inclusion Cafe and begin to just start to think about, what is it that I can do? What is it my responsibility to do? And what am I absolutely going to take responsibility for? Let's have the next slide, please, Will. I also want to tell you about our Cultural Ambassadors programme. It primarily works across England, but what it attempts to do is a number of things. Firstly, it attempts to strengthen the partnership working with employers, particularly where those employers know that there are key issues that emerge in areas like, grievance and disciplinary numbers, where they see an over-representation of Black and minority ethnic staff. Crucially, it aims to build the racial and wider inclusion literacy of participants. So how many times have you ever heard people that often talk about not knowing the difference between different forms of discrimination, or assuming that positive action is the same as positive discrimination, and it isn't. But also it aims to support organisations working to deliver against the NHS workforce race equality objectives. So this programme that we've developed has one that has been quite transformational, both for participants but also for organisations, and I'd advise you just to have a look online just to see what people are saying about it. But I would like you just to have a quick look at some of the images that you see at the top of this slide, where this isn't about beating people up, this isn't about blame, but it is something as radical about empathy. And there's something really powerful and radical about recognising that it is okay to respect each other's differences, that we don't have to pretend that we're all the same, we are not. And I think Jean put that beautifully. And then there's also something to recognise that when we start to remember all of the things that we have acquired in terms of skills, knowledge and ability, actually most of us are going to be really great in this space once we give ourselves the opportunity. So once we clear out the, well, should I be doing this? Is it really for me? Can I? Well, you absolutely can. You've been naturally brilliant your whole life at acquiring new skills, and this is no different. And then I guess the final thing that we encourage people to think about is that their stories matter. Each one of us on this panel has stories of our own lived experience, and each one of you listening out there, wherever you are in Wales or wherever you are, will have your own story. And for me, it becomes really important to kind of start sharing your story, just as Richard has begun to do after 34 years as a nurse. Because if you don't tell your story, actually someone else may tell them for you. And my worry about that is that they might not get the tonality right. They might miss key bits. And so it's really, really important for you to kind of share what your story is. And I would also really ask you to think about some of the things that you might want to get involved in, which is our Nursing While Black podcast. So let's just have, I think it's probably one of our final slides on this one, please, Will. So whilst we are really happy to talk to people about all of the different things that you can do, I wanted to just leave you with some very kind of clear things that you could do just within a few moments. So we've talked about the importance of listening to voice, and Jean spoke about that. She's asked senior nurses across Wales, how do you listen? How do you hear the voices of nursing, of Black and minority ethnic nurses? How do you hear those voices that may have felt silenced, or may have felt hard to listen to, or hard to be heard? How do we do that? And so what the RCN has done is begun to ask nurses from a wide range of backgrounds to tell us about their lived experience. And not only are they sharing that with us, they're also sharing their prescriptions for change, the things that they think will make a difference if you're wanting to be an ally, but also wanting to create system change. They're there speaking about that. I suppose the next thing that you can do, so listening becomes really powerful. It becomes a really important moment to listen to the things that perhaps haven't been heard, perhaps haven't been understood. The next thing that we can ask you to do is to think about how you connect. So although we've got a corporate priority around connecting and communicating across difference, that works at your level too. That works when we act as, well, what is it that I don't know? And what is it that I need to be curious about learning about? So if your organisation has staff networks and equality leads in your organisation, please attempt to connect with them. Ask them about the work that they're doing. Ask them how you can be helpful. Ask them about the things that are currently missing and the things that aren't yet done, but also connect with us on Twitter. And so our Twitter handle is there. Build your knowledge of how to be a great ally. So it's not a destination point, it's not an end identity, but it is about building trust, it is about building confidence, and it is about knowing how your own privilege works and shows up in the workplace. And then finally, I'd ask you to watch. Ask you to watch the RCN webinars that took place over the summer on race, racism and nursing. And I'm so pleased to say that you will see a continuation of the wisdom and insight shown by Jean in those conversations. And those conversations have lots of examples of lived experience, but also lots of information about change, but also lots of information about the things that we can do at every stage of our nursing careers. So that is just a really quick run through of some of the things that we are doing at the RCN, but definitely connect with me online via Twitter. I'll be happy to connect you with the other stuff that we're doing in this space too.
Wendy, thank you so much for that. That was just so inspiring, and some practical issues that we can use. Can I just say, we have run over. We've got about 4 minutes for questions, and for people who have written their questions in, we will ensure that there is answers going back to everybody who has done that. I do want to, there's a lot actually about leadership, Jean, and about what can we do to support diversity in leadership and improve diversity across all roles. Is that, I know you touched on that and you spoke about what you've done as CNO, but what about the diversity across all roles, rather than just the nurse directors, for example?
So I think you're quite right. Our experience is that we need to support people to reach their full potential, and a lot of folk need the encouragement and support in order to do that. So we're exploring at the moment whether or not we should invest in some leadership development programs dedicated specifically for nurses and midwives from a BAME background. Really, you know, it's about giving people the opportunity and then helping them have the confidence to actually take those opportunities. And that's what I'm really interested in. Thank you.
Sure. And there has been a comment, there's been lots of comments, the questioner has asked, it's from Charlotte Davis actually, about the Black population getting infected by COVID, but they have no control over who gets that. We have no control over who gets that, whatever their ethnicity. Richard, what advice would you give to our colleague Charlotte?
Charlotte, thank you for the question. Charlotte's absolutely right. COVID does not discriminate. But what we do know is that during the pandemic, COVID has disproportionately affected those from a BAME population. It's also affected those older vulnerable groups, but it's also affected those BAME populations who work within health and social care settings. Some of the stats I shared earlier today are for individuals to digest. So what I would say is to Charlotte, yes, it's a virus that doesn't discriminate, but it does affect those BAME populations, both in the community and those working in health and social care.
Yeah. And a question for Wendy and Jill, really. The listener was talking about, and Wendy, probably the first part of this question to you. The questioner says, please be mindful of the language we use, as people are not BAME people. They have a right to self-identity. And also, Jill, what happens after the 6-month project for the helpline? These issues do not go away. So Wendy, to you first.
Great. I think that's a really great and important question. Yeah. So when I use the term BAME, I am thinking about Black, Asian, minoritized ethnic communities, and I'm using them as a deliberate shorthand. And I know that it compresses a whole range of differences in traditions, etc. So I'm using that as a deliberate shorthand to do that. I don't think that it is, I don't use it as a descriptive word. So I am not a BAME. I'm not a BAME. I'm a Black woman but it should be used in the context of absolutely as a policy term that compresses a whole lot of difference to enable some kind of very, very broad analysis. And I absolutely agree with the person's point of view. Absolutely, we need to be really mindful and respectful of people's ability to determine themselves, to determine how they are referred to, because that is the height of, I think, respect and the whole point of inclusion. So yeah, completely agree.
Thank you. Will, have we come off live?
No, not yet.
Okay, so Jill, could you just finish that? When is the 6-month project? What happens after that?
Absolutely. I've just put a link in the message box now, a link directly to the new helpline that I mentioned. And yes, it is a 6-month pilot, initial 6-month pilot, which will of course inform if there's a want or need and how the helpline could best meet people's needs. So the helpline is very specifically aimed to post to relevant organisations, provide employment advice, refer to specialist information community languages, and it's initially only opened from 10:30 to 2:30 Monday to Friday. However, the 6-month pilot will determine what, if and how it's taken forward and continued in funding. So it's a pilot to explore the need.
Okay, so there could be good news after the 6 months, we never know. I think that do you know this? We could have gone on. There's so many people who are asking questions, and as I said, we will make sure that we get those answers to them where we can. I would just like to thank every single one of the speakers. It's been a fantastic hour, and also to let people know that we will be doing some more webinars. And we will share the slides and links with everybody as well who has been on today. In conclusion, I just want to pull out something. I was reading something the other night, and it was something that really resonated with me, and that is diversity is a fact, inclusion is an act. And I think that, Wendy, your presentation really resonated with me because it was practical in terms of ensuring that we listen, we connect, we build and we watch, and that we challenge and we act. You know, some simple, it sounds very simple, and I think that's what you were saying, but I think that we have to think of it on an individual level with everybody. So more to come, and I hope that the webinars we do in the future, we are expecting to do a few more, are as informative and thought-provoking as it has been this afternoon. So thank you all very much. Thank you all of you who tuned in. Really appreciate it, and we will make sure we get some of our answers back to you. So thank you all, and we'll sign off. Thank you.